afternoon, sir. My project topic is effectiveness of hold relax versus contact relax muscle energy technique on pain and increases the cervical range of motion in patients with acute upper trapezitis.
Pain and increase the cervical range of motion. Okay, I'll tell you later.
Upper trapezitis, it is a frequent musculoskeletal condition, sir. It causes pain and muscle tightness in our upper trapezius muscle. So the muscle is very tight. It is caused by various reasons like tenderness, muscle stiffness, restricted cervical range of motion, and prolonged activities, poor posture, repetitive movements of upper limb. Then epidemiologies are 30% to 93% of individuals are affected with this musculoskeletal pain.
Acute trapezitis. So you are going to reduce the pain in acute trapezitis. Okay.
The prevalence of the study is occupational group approximately 57.9.
Okay, I can understand. You go for the need of the study.
The need of the study is to reduce the symptoms and to compare the hold relax and contact relax technique.
Okay. Reduce the symptoms means you are saying about pain.
Pain.
Pain, then restricted cervical range of motion. Okay. Restricted range of motion, tightness and pain. Okay, go ahead.
My aim of the study is compare the effectiveness both hold relax versus contact relax.
Okay.
Then objective of the study to determine the hold relax effectiveness and then to determine the effectiveness of contact relax in reducing the pain and improving the functional outcome in individual with acute upper trapezitis. Then to compare and contrast the effectiveness of hold relax versus contact relax muscle energy technique on pain and cervical range of motion in patients with acute upper trapezitis.
To compare the effectiveness of hold relax versus contract relax muscle energy techniques on pain and cervical range of motion, which is okay. Objective to determine the effectiveness of. Okay, we'll discuss later.
Alternative hypothesis: there is significant difference in pain reduction and functional outcome improvements between hold relax and contact relax exercise program in individuals with acute upper trapezitis. Next, null hypothesis: there is no significant difference in pain reduction and functional outcome improvement between a hold relax and contact relax exercise program in individuals with acute upper trapezitis. These are my review of literature.
Okay, where is the mother article?
First one, sir, immediate effect of muscle.
What they have said in that?
They said, they not said about hold relax and contact relax, but they said about muscle energy techniques.
Okay.
Muscle energy technique is more effective in reducing the upper trapezitis.
Oh, they have given it for upper trapezitis.
Yes.
They have mentioned the upper trapezitis?
No, neck pain, sir.
Okay.
And they increases the cervical range of motion.
Whether they have mentioned upper trapezitis in this, because you said immediate effects of MET combined with the conventional PT on neck pain and the cervical range of motion. MET added to conventional physiotherapy resulted in greater short-term reductions in neck pain and improvements in cervical range of motion than conventional therapy alone. I think they said whether that is upper trapezitis, it's not mentioned over there. Okay. Okay.
Next, methodology, sir. Study design: it is a comparative study. Study population: individual aged between 18 to 30 years experiencing the upper trapezitis during daily activities.
Okay.
Study size and sampling technique following the randomized studies.
Okay.
Group A, I am going to give 10 members. I am going to give hold relax technique, and group B 10 members contact relax technique, sir. Study setting: OPD, Department of SS College of Physiotherapy. Study duration 6 months.
Okay.
Next, selection criteria: inclusion, exclusion criteria. or equal to 4 weeks. Presence of palpable third band and tender spots with
Right. Individuals aged between 18 to 35 years to diagnose with the upper trapezius myofascial trigger points. That upper trapezitis which is occurred because of trigger points.
pain.
Okay, you have to say diagnosed with the upper trapezius myofascial trigger points. You have said. Why? Because we are not dealing with the trigger points.
Pain.
So it is not mandatorily to say about trigger points. It may be because of trigger point, it may not be because of trigger point, but we are concerned about hold relax and contract relax. So you can simply say diagnosed with the acute upper trapezitis. That's it. The duration not more than 4 weeks. That is chronic.
Below.
Maybe less than 1 week. Less than 1 week or 2 weeks. 2 weeks. Less than 2 weeks is better. Presence of palpable thought sign and tender spot no. Willing to participate is okay.
Next, the exclusion criteria. History of cervical spine injury, fracture or surgery, neurological deficiencies like radiculopathy, numbness, tingling sensation, any systemic or inflammatory conditions like fibromyalgia, arthritis, recent physiotherapy treatment for neck, shoulder pain within 3 months,
Okay.
contraindication to MET or exercise, severe pain, acute spasm infections.
Okay.
Next, variables,
One, any, two, functional limitation, okay.
dependent variables, pain, motion limitations, independent variables, hold relax, contact.
Index, okay.
Next, materials used, chair, couch.
Okay, fine. So, independent variables, hold relax and contact relax. Functional limitation and the dependent variables. Okay, that's what we would say.